this feeding workshop before I gave birth, and one of the things I said, I was like, don't use pacifier. So of course, what am I doing? I mean, the pacifier is just constantly, it sounds so funny. But yes, I will hopefully stop that.
Because as a speech therapist, it's like the thing you learn when you're in school. Don't you dare give your baby a pacifier.
Is there a certain age that you should really start?
Really, when the teens start coming in, because
It,
you know, pushes it
them
forward. Yeah, and also, I mean, you know, of course, they make better ones these days. So, you know, made by, you know, created by orthodontists or whatever. So, you know, the older ones used to kind of push up, so it would almost create like a U shape, you know. So that, of course, would make your sound not correct. Yeah.
But my 28-month-old, he still nurses.
Okay.
So, is that a concern?
No.
Okay.
Yeah, because that's like more, you know, it happens and then it stops. But, you know, kids that are hooked on pacifiers are hooked on pacifiers.
Yeah, in terms of speech, like it's going to impact their speech, their ability to make certain sounds?
It can. It can. Yeah.
Or a thumb.
And a thumb.
Yes, exactly.
My almost 4-year-old.
Yeah.
And that's
Yeah.
because it can change the palate?
It does. Yeah, it can. Your palate is still shaping and forming, and you can actually have a vaulted ceiling. So for example,
It's
yeah,
very high art.
there you go. Perfect. And for me, I actually have a really high arch, and I remember being in school and we had to do an exam, and they're like, "Wow, you have such a vaulted ceiling." Because I refused to give up my bottle even in first grade. Seriously. So that's why I have that vaulted ceiling. So it really does affect the way you speak. So something to think about.